Hi, everybody. I'm really pleased to be here and having this platform to talk a little bit about integrative medicine. This is something that probably a lot of us have heard before about integrative medicine, complementary medicine, alternative medicine, and sometimes the terms are confusing, but recently the term integrative medicine has been used more frequently. And I just wanted to kind of like let everybody know what it is, and then we'll talk a little bit about the Osher Center at University of Washington, who we are and what we do. And at the end, I will be happy to answer some questions. I'm keeping the presentation pretty light in order to allow you to ask questions. So I'm a physician. I'm a family medicine physician trained at University of Washington. I'm also a licensed acupuncturist, and I got my acupuncture degree from Bastyr University. I'm also faculty at Bastyr, and I'm associate professor at the Department of Family Medicine, and I'm board certified in integrative medicine. Currently, I'm the director of the Osher Center for Integrative Health at University of Washington. For the purpose of these slides, if I can, let's see, maybe if I use this one. I have no conflict of interest to disclose. And my dear friend and colleague, Dr. Deborah Bell, who does integrative primary care for us, unfortunately, she was not able to join us for this presentation, but I have used some of her slides here for the messaging of integrative medicine and what it is. A little bit about Osher Foundation. This is the name of the gentleman out of San Francisco. This is Mr. Osher and Mrs. Osher. They have a foundation. The foundation, and it's spinning down, so they're wrapping it up next year. They have sponsored 10 centers for integrative health and medicine across the country, and one in Karolinska. And these are the centers that we have across the country: UCSF, Harvard University, Karolinska Institute in Sweden, Northwestern University, Vanderbilt, University of Miami, University of Washington. In 2018, we came into existence, and that was actually the first time ever that the term integrative medicine, integrative health and medicine was officially being used at University of Washington for a center. Then 2021, we have University of Cincinnati and University of Wisconsin in Madison, University of Utah, and the last one, University of Vermont in 2022. So collectively 10 centers and one center in Sweden. We do form a collaboration. We call it Osher Collaboration. Each center has their own unique character and unique services that they offer in regards to education and services. Like University of Vanderbilt, they're extremely strong in mind-body practices. In University of Wisconsin, they have 25 years history of integrative medicine in education. They have fellowships. So we are extremely pleased to be part of this group, and our diversity is our strength, and we learn a lot from each other. The UW Osher Center for Integrative Health, and this is our mission: to bring together conventional and complementary practices to promote health and well-being and illness prevention. So a lot of focus on prevention and health. We emphasize on a holistic and person-focused approach to healthcare and wellness, treating the whole person. One of the terms that you'll be noticing that I'll be using frequently throughout this presentation is the term person. I try not to use the term patient, and we have people, individuals, persons who live with a condition, and that condition, that health condition, does not define that individual. So this is intentional to use that term person or individual or people. Before we talk a little bit about what is integrative medicine, complementary alternative medicine, I wanted to bring everybody's attention to how we approach things in conventional medicine. Now, before I present these two cases, I just want to make it very clear that when we talk about integrative medicine, when we talk about complementary alternative medicine, the goal is not to take anything away from conventional medicine. The goal is not to reduce the value of conventional medicine. Conventional medicine has done great work to keep people healthy and to fix the diseases. But the goal here is to bring something else on the table to actually enrich our approach for people's care and to bring more tools and skill sets on the table and allow our providers, our physicians, the next generation of providers to learn these skill sets, to learn and harness this knowledge and offer it to individuals. From the other perspective, you see a lot of people now are using non-conventional therapies. A lot of individuals are using herbs and supplements, and they go Google it and they order through Amazon. So this to some degree reflects the fact that the demand is high. People are interested in using non-conventional routes to maintain their health, to promote their health. But is it really the best way of incorporating these non-conventional modalities into somebody's care? Most likely the answer is no, because especially with supplements, that's something I do a lot, is the quality of the supplements really matters. Where you get the supplements really matters. The safety of the supplements matters. Are these supplements safe for this specific individual or not? And at the end, the question is that, is there really a need to use these supplements? If somebody has a good diet and they have a whole rainbow variety diet and they have a good digestion, do they really need supplements? Or where is the data supporting the use of these supplements? So this is something that has always been a concern in the field of integrative medicine. And we, as integrative medicine specialists and providers, we take it very seriously. That is our job to actually guide our communities, our patients, our colleagues regarding the appropriate use of non-conventional modalities. So very briefly, these two cases, they are both cases of migraines. One of them is a 25-year-old female, has history of migraines. Her migraine headaches, typical one-sided, get worse around her period, has a couple of days of severe headache, and throbbing pain, one-sided, photosensitivity, has been dealing for some time and goes to the provider. They prescribe some medication. And these medications have to be let's call it a triptan medication. So they're taking triptans. They're getting good results, but they're not interested in continue taking this. The next case here is a 45-year-old male. They also have history of migraines. They have been dealing with migraines for the past 20 years. They were diagnosed later in life, later in their 20s, actually, in mid-20s. And they have noticed that these migraine headaches kick in when they are more stressed. They have a very stressful job. And when they're more stressed and work is more demanding, they get more migraine headaches. They went to the provider and they were also given this medication called triptans. And they're using triptans with some good effects. And then they decided that, well, is there something else that I can take or do to reduce the intensity and frequency of my migraines? So the first thing that it's important here is that both of these individuals, they received the same treatment. We gave them a pill from the family of triptans. So the first scenario is a 25-year-old female. They have female hormones, estrogen and progesterone, and it happens that the headaches are worse during their period or around their period. The second scenario, they have testosterone and they have more headaches, which is related to stress. The migraine headaches related to stress. But the treatment that we offered both of them is the same. Is it the right approach or not? One might say that, well, it's controlling their pain. But we took the individual approach to care for these individuals away from them. We ignored the fact that maybe there are some other factors like hormonal balance or stress or life circumstances that are contributing to these individuals' headaches. that if we fix them, if we modify them, then we don't necessarily, they may not have headaches, and maybe they should not be on the same category of medication. So this is the difference that we have in the field of integrative medicine with the field of conventional medicine, that each individual is different. The approach to health for each individual should be different, and we have to individualize our approach for care for each individual. There's a model that is becoming very popular in the realm of medicine, and it's a salutogenic approach to health. Salutogenic is opposite of pathogenesis, or a reductionistic model of health, or of approach to care, actually, sorry, not health, reductionistic model approach to care. In pathogenesis, we focus heavily on what is causing this disease and how can I suppress the condition. In salutogenic approach to health, the approach is how can I improve health and well-being? How can I empower this individual? Or how can I provide more tools for this individual to increase their resilience? And as part of this approach, they become more healthy. They have a healthier lifestyle, and as a result, they stay more healthy compared to what is the problem? Let me put a Band-Aid, I'll give you a pill, but hardly ever we focus on the root cause of the condition. So each of these conditions, they have their merits. If somebody has appendicitis, they have acute appendicitis, sure, by all means, the appendix needs to come out. If somebody is suffering from infectious diseases, yes, they need antibiotics. Nobody is denying that. If somebody's blood pressure is really, really high and it's dangerous, yet at that point, they need medication to lower the blood pressure. But are there other modalities? Are there other things that we can contribute to this individual's life to improve the quality of the life? Are there things that we can do through lifestyle to improve their health? So hopefully the individual with hypertension, they may not necessarily need to continue medication, or they can have a lower dose of medication as they modify other lifestyle factors. So salutogenic approach to health versus pathogenesis. Integrative medicine focuses heavily on salutogenic welcoming health. This is what it means to welcome health, or generating health. What is integrative medicine? Integrative medicine, interchangeably integrative health and medicine, integrative health. These are the terms that we have been hearing a lot. There was a time about 20, 25 years ago that we used the term complementary alternative medicine, and that would be anything that would refer to as non-conventional. So anything that was not part of allopathic or conventional medicine, we would call it complementary alternative medicine. And as we move forward, we started generating more data that these complementary alternative medicine, there is a place for the use, and they can actually contribute to people's health and well-being. So maybe we should consider incorporating them into the healthcare system, into our plans for care for individuals. And then we started coining this term integrative medicine, meaning that we integrate these non-conventional models into the healthcare, and we use whatever is necessary, whatever is needed for the individual to improve their health and well-being. So integrative medicine is a whole person care. It addresses all factors that affect health. So what does it mean, all factors? Is it something that conventional medicine actually ignores it? No, we talk about these things in conventional medicine. So we talk about sleep and quality of this sleep. To some degree, very, very limited, but to some degree, we talk to individuals about their diets. What do we do about diet with our individuals? We tell them, don't eat this, don't eat this. So in conventional medicine, we have done a very good job regarding telling people what not to do, but we don't do a very good job in telling people what to do. So we tell them, okay, well, go see a nutritionist, go see a dietitian, and hopefully they will guide you regarding what you can eat. or with their physical activity, well, don't do these activities, but what you should be doing, I'm going to send you to a physical therapist and they will tell you actually what are the exercises that you're supposed to do. What if we had providers that to some degree and some extent had the knowledge that they could actually initiate the conversation with the patient, that I tell you not to eat simple carbs, but I would like to encourage you to eat more complex carbs. And these are complex carbs. I can give you a handout regarding what it is. At the same time, I put a referral for you so you can go see the nutritionist and dietitian. That way, patients feel more encouraged to actually partner with the provider and make the changes happen instead of, okay, good luck to you. I told you don't do this. This is your referral. And wait for the time that comes, you have your appointment. So the whole person care would be addressing all factors that affect the health. It is a holistic approach that takes body, mind, and spirit into account. Is it something, again, this mind and spirit, is it something that it gets ignored in Western medicine, in conventional medicine? No. When we go through our residency to our medical school, one of the things that we are taught is that if an individual, a patient, wants the physician to pray with them, even if you don't believe in their belief system, it's encouraged that you just join them in their prayers. So we do acknowledge the fact and that there is a value in partnering and participating in people's spiritual care. And this is something that in holistic medicine, in integrative medicine, we bring it to the surface. We say it is important. It is important not to only take care of the body, but also mind and spirit of individuals to make them healthy. If I can. Integrative medicine is oriented towards healing. It recognizes that each person has a unique needs, and the person and practitioner partner to seek health and healing. So there's a difference between cure and heal. Somebody gets an infection, you give them antibiotics and they're cured. The infection is gone and they're cured. But somebody has a mental issue, they have a psychological issue, or they have a chronic illness. They may not necessarily be cured of the condition, but they can heal. Healing is a deeper process, is a longer process than curing. And in integrative medicine, holistic approach to health, we like to focus on healing. One individual may not necessarily get cured. For example, individuals who live with memory loss or individuals who live with cancer diagnosis. They may not necessarily get cured, but at some point they come to the acceptance of their new condition and how to live with this new condition. And that is part of the healing. So they embrace the new health condition that they have and how to live with it. And that would be part of healing. It is the job of us in integrative medicine, actually the job of all providers, I think, to guide our patients and individuals how to actually heal instead of just how to cure them. This is a graph from NCCIH, which is a branch from NIH, which talks about holistic approach to health and whole you. At the individual level, providing care for individuals includes biological care, behavioral care, social care, environmental care. And then it expands beyond the borders of one individual, extends to the family, then to the community and population care. And that would be the best care actually possible. When we talk, a good example here is cardiovascular diseases. We talk about cardiovascular diseases and individuals who are centennials. They live long life in blue zones, for example, in Okinawa, and we start looking at what is their lifestyle. What do they do that they are so healthy? At some point, we started looking at their diet, and we said it's Okinawa diet, it is Mediterranean diet, it is this diet and that diet. But then we started going beyond just the diet, what these people eat. And we focus on their lifestyle. One of the main things is that they are very well connected in their community. They are very physically active. They engage in the community. At the age of 80 and 90, they still participate in the community as much as they can. And there is a sphere of health and health-oriented activities that it's created around them as part of their culture that's keeping them healthy. So that approach is very much in tune with what NCCIH and NIH are saying. That approach to health should go beyond the individual to the families, to the communities, and extend it to the population, and providing this care for the whole population to keep the population healthy. And this is something that we talk about a lot in integrative medicine, to go beyond the individual and focusing on a larger group, which would be family, community, and population health. So going back in integrative medicine, the focus is on healing. It's individualized plan. So somebody can come back and say, this is wonderful to have individualized plan for each individual and their needs. But at the same time, it is challenging because each individual is different, and based on their needs, they need different approaches to health. And that is correct. That is absolutely correct. So this is the beauty and this is the challenge of integrative medicine. The beauty is that you work with that individual with what they need, and the challenge is you work with that individual with what they need. So it makes it to some degree challenging, but at the same time, when you come up with a plan with the individual, then the individual is part of the plan. They understand the plan is for them. Integrative medicine is a holistic, person-focused approach. We definitely consider all aspects of one's being that contribute to their health and well-being. It's empowering people to become and stay healthy. So it's not just a disease management, but it also how we create health and how we help maintain health. Partnership in care, it's not just patients' responsibility. It's not just physicians and providers' responsibility. It's a partnership. We offer the options. We go over the options. If the individual is really, really interested in taking supplements, we educate them for this and this and this reason. These are not the right supplements for you. Maybe you should be taking these supplements, or the brand that you're taking is not the right one. You should take the other brand. Respect the wisdom and usefulness of conventional medicine. I mentioned it from the beginning that yes, we are physicians, we are MDs and providers in the field. Most of us, we are trained in conventional medicine. So the goal is not here to take anything about the value, anything away from the value of conventional medicine, but adding into it and bring something more on the table. And the modalities and routes that are being offered, we really emphasize that they should be data and evidence informed, supported by data, definitely making sure that we do have data regarding usefulness of these modalities. One example is acupuncture. There was a time that acupuncture was being questioned, that is acupuncture effective or not? And we have passed that period. Now, when we talk about pain management, one of the first things that comes to everybody's mind is acupuncture. Send them for acupuncture, because we have generated enough data that shows acupuncture is effective for pain management. So there are some other modalities in the realm of integrative medicine that they are in their infancy, or they are in the period that they are generating a lot of data. So hopefully in the next 5 to 10 years, we'll have more data that we can use to rely on non-conventional modalities when we offer non-conventional modalities for health and well-being. Couple of the services in the realm of integrative medicine. As I mentioned, my dear colleague, Dr. Deborah Bell, she has a very unique practice, and her practice at Northgate Clinic is integrative primary care. Dr. Bell has been doing this model for more than 30 years. And what she does, she just works full spectrum primary care, but she incorporates integrative medicine into primary care. And this is a very unique model. This is by no means, it's not easy to do based on the model of practice that we have, that each provider, I don't know, we have 15, 20 minutes with each individual. But it is doable. It is definitely something that we need to have more of these providers. People come in. If I don't ask this individual if they're taking supplements or herbs or some other non-conventional approaches to care, unlikely they will disclose it. And maybe what they're doing, it's not safe. So it's important for me as a primary care to address those issues and address those matters with the patient. So integrative primary care, we bring nutrition and lifestyle counseling. We address mental and spiritual health, stress reduction, mind-body medicine, non-pharmacological approaches to health, including vitamins and supplements. The goal is to focus on the big picture and root cause. If my blood pressure is high, what is causing my blood pressure to go up? If my blood sugar is not well controlled, what caused it? And are there things that I can do in regards of my lifestyle? Can I change my diet? Can I be more physically active? What does physical activity mean for me? What are the things that I can incorporate? Well, I have bad knees, I cannot run, but are there other activities that I can do that actually counts towards like physical activity, helping with my exercise? And if needed, we can definitely provide referrals to other services such as acupuncture, physical therapy, massage therapy, and psychotherapy. And as part of integrative primary care, we address issues, chronic and acute conditions. The next part is Integrative Medicine Consults. So the first one that Dr. Bell has created this model at Northgate, and we're hoping that we will have more expansion of this model, was integrative primary care. But the other model is a consult model. And this is where myself and my other colleagues are mostly functioning. As a consult, we get a lot of referrals, patients coming to us, and they've been referred to us by other providers. Most of them, they have questions regarding supplements, regarding herbs, if there's any contraindication of taking these supplements, or if there's some other modalities that they could be incorporating in their healthcare or in their care. For example, I get a lot of, I do acupuncture as part of my practice, and I get a lot of referrals for pain management through acupuncture. And the question is always is this case a good case for acupuncture? Would acupuncture be able to provide any relief for this individual? So that would be more of a consultative model in integrative medicine. So evaluating the patient from an integrative medicine approach and making treatment and health and healing suggestions. Integrative medicine consult is not involved in an ongoing conventional primary care. So meaning that we don't take over of being primary individuals' primary care. And single, multiple, or ongoing visits, that's always a question. People come and have the consult, then they ask, can I come follow up with you? Yes, by all means, people can definitely follow up. Again, we will not be taking over as the primary care, but they can come and see us as an ongoing basis for consults. And primary care practitioners can collaborate with Integrative Medicine Consult to whatever extent it's desired. Currently at the Osher Center, we are a clinic without walls. We are operating through different clinics. 3 clinics that we have, Factoria Clinic in Bellevue area, Factoria, Northgate Clinic, and also UW Sports Medicine Ballard Clinic. So these are the 3 clinics that the Osher Center providers are seeing patients there. The services that we have here, we have integrative primary care. I mentioned Dr. Deborah Bell is doing it at Northgate. Integrative Medicine Consults. This is something that I do at Factoria Clinic and myself and my colleagues at Ballard Clinic. Naturopathic Consult, we just started it. One of our dear colleagues, Dr. Tom Yang, he's the first naturopath that we actually were successful at credentialing him into the UW system to provide naturopathic consults in primary care for us. And he has just started seeing naturopathic patients. And he's also an acupuncturist and provide acupuncture. We have acupuncture services. In 2012, when I started with UW after my residency, I was the only one doing acupuncture in primary care for a very long time. But now we have 4 acupuncturists plus myself that we are providing acupuncture services. It's very well received and everybody is extremely busy. Massage therapy, we just hired a massage therapist that's going to start with our team starting in January of 2024. And we are looking forward to having them. And we do also have some courses through one of our colleagues, Dr. London Breedlove, MBSR courses, mind-body practices, that I think every 6 months they offer this course, and we usually post them on our website for individuals who are interested in taking those courses. As part of our activities that we had this year, we had a 5-session series regarding brain health and nutrition. These sessions are done and they're all recorded. In the first session, we had Dr. Emily Wong talking about Mom Your Brain. What does it mean? How you actually take care of your brain and how you improve the health of your brain. In the second one, I gave a speech regarding healthy gut and healthy brain. How does the health of our gut relates to the health of the brain? And we also had a chef that cooked with us. He cooked an anti-inflammatory diet. And as part of the cooking, we talked about the value of the spices and the nutritional value of the spices and the food. Then we had food for thought, meal planning for optimal brain health. The other one was August 24th, Food or Supplements by Dr. Bell, that do we really need to take supplements, or are there a lot of minerals and micronutrients that we can actually get through our food? And eventually September 28th, we had Food and Mood. Dr. Tom Yang talked about how food and different ingredients in food can affect our mood. So these are the QR codes are on the website. Everything is recorded. If you just scan the QR, you can watch the recordings. This is our website. We are a section at the Department of Family Medicine. And you could go to our website. It will guide you how to make appointments and how to get in touch with us in case you are interested. And this is the link that I would like to provide, familymedicine.uw.edu/Osher, and it will take you back again here to our website.